Now let's look at the muscles that act on the hip and the lower limb. They're the largest muscles in our body. They're less made for precision and more made for the strength needed to stand, maintain balance, walk, and run. Several of these muscles cross and act on 2 or more joints. Beginning with the anterior muscles of the hip. The primary ones here are the iliacus and the psoas major. Together, they form the iliopsoas muscles that lead from the top of the femur through the pelvic cavity into the lower spine and hip. Tension in these muscles leads to a lot of lower back pain. As you can see, pulling from the femur to the vertebrae, we're going to pull on the lower back and create stress in the lower back. So keeping the iliopsoas group lengthened releases a lot of tension on the back. Those of us that do a lot of mountain climbing and cycling and running have especially developed iliopsoas muscles. Gluteus maximus is the primary muscle we see here on our glutes. The gluteus medius is a very large muscle also. It passes beneath that. And the gluteus minimus we see even beneath that. If we look at it from the iliac out, we see the gluteus minimus, the gluteus medius, and then the gluteus maximus. Piriformis here may not be in our list, but it's a muscle that I like to highlight because as you can see, it comes very close to where the sciatic notch is right here. And so as the muscles of the gluteal region become very tight, you can see how the sciatic nerve coming out through the sciatic notch could get pinched between piriformis and gluteus medius and gluteus maximus. This produces some of the pain that we see in sciatica. The tensor fasciae lata, or TFL, otherwise known as the IT band, covers over the whole buttocks region and the outer thigh. It extends all the way down to the knee on the lateral side of the thigh and becomes very tight in athletes who have high demands on the gluteal region. There are 6 muscles that act as lateral rotators that are inferior to the gluteus minimus. We have the gemellus, gemellus superior and inferior, the obturata externus and internus, the piriformis, and the quadratus femoris. Know that all these muscles are in here. However, the piriformis is the most notable of these. So the rest of these you can take off your list of responsibility. In the adductor or medial compartment of the thigh, there are 5 muscles. We see adductor brevis, adductor longus, adductor magnus, gracilis, and pectineus. Now we do need to know each of these muscles. We can see pectineus here, adductor magnus right next to it, adductor brevis right next to that, and adductor longus. All of these are involved in adducting the thighs. Now let's look at the anterior or extensor compartment of the thigh. This is the bulky portion of our thigh. It contains the large quadriceps femoris muscle. Quadriceps implies that it's made up of 4 bodies. The quadriceps is composed of rectus femoris on the top surface, as well as vastus lateralis on the lateral surface, vastus medialis on the medial surface. And then where's the 4th one? Well, right beneath rectus femoris, we see vastus intermedius. You can see that highlighted in this deep visual here. The quadriceps muscles are the prime mover of knee extension. It's the most powerful muscle group in the body. Each of these 4 muscles converge on a single quadriceps or patellar tendon that you can see here. It extends to the patellar and then continues beyond the patellar as the patella ligament and inserts on the tibial tuberosity. The sartorius is the longest muscle in the body. It extends from the lateral side of the hip all the way down to the medial side of the knee. On the posterior compartment, we see the hamstrings group. From lateral to medial, we have the biceps femoris, the semitendinosus and the semimembranosus. The semitendinosus and semimembranosus muscles both insert on the medial side of the knee. The biceps femoris also has two heads, and it inserts on the lateral side. As we move down into the lower leg, let's look at the anterior compartment. This compartment's involved in dorsiflexing the ankle. It prevents the toes from scuffing as we walk. It involves the fibularis or peroneus muscle, the extensor digitorum longus, the extensor hallucis longus, and the tibialis anterior. The most notable is the tibialis anterior. But also you'll note fibularis longus, fibularis brevis, extensor digitorum longus. Now as we move to the posterior compartment of the leg, we'll have a superficial group and a deep group. There are three muscles in the superficial group. The gastrocnemius, which we can see here, has two heads. This is the big muscle on the back of your calf that you would see grow from calf raises. Beneath it lays the soleus. The soleus is much more a postural muscle, so it becomes less developed. Both of these share the same tendon going down into the calcaneal tendon. The gastrocnemius and soleus together have a collective name. It's called the triceps surae. Now let's look at the deep group. There are four muscles in the deep group: the flexor digitorum longus, the flexor hallucis longus, the tibialis posterior, and the popliteus. So I'm less concerned that you have a grasp on the deep muscles than the superficial muscles. The ones that you can palpate from the outside are most important. In the lateral compartment, there are two muscles, the fibularis longus and the fibularis brevis. Again, be familiar with their presence, but don't commit too much time to identifying these muscles. In the foot, there are some intrinsic muscles. There are 4 layers on the ventral side. They support the arches of the foot. They abduct and adduct the toes as well as flex the toes. There's one dorsal muscle, the extensor digitorum brevis, extends all the way into the toes. So, there it is. This covers all of the muscles that you need to know. So as we look into the lower leg, most important are going to be the superficial groups. Know that there are many different muscles in the deep groups, but don't spend too much time trying to find these. Be familiar with some of their names, but you won't be required to identify them specifically. Now, add all of this into your outline and spend some good time out there in Anatomy and Physiology Revealed and become familiar with each of the muscles that have been discussed in this lecture. You've got your outline. Go out there, check it out, find it. We'll see some of these as we dissect the cat. However, many of the muscles in a quadruped are markedly different.